Hello, welcome to the Ohio Department of Aging's Assisted Living Service Updates training. Today's training is a pre-recorded webinar and is intended for certified assisted living waiver providers. The agenda for the training includes an update regarding the community transition services. We're going to share the new rates as well as the billing codes for the assisted living service. We'll review the memory care attestation that was sent out and many of you returned. Talk about the changes and the updates to the assisted living service rule. Talk about the person-centered service plans and review next steps. I'm going to walk you through some parts of the Department of Aging's website to familiarize you with the topics on here that are most applicable for you and your work. So the Department of Aging's website is aging.ohio.gov, and this is the homepage that you'll see when you come to the website. One thing that I encourage you to do is scroll down to the bottom. And the gray, this bar all the way at the bottom, you'll see subscribe. I encourage you to add your name to the contact list so that you can receive periodic email updates from the Department of Aging. And there are two options here. You can subscribe for the email by clicking down here or in this blue box on the right side of your screen as well. Next, at the top of the website, you'll see 4 agencies and service providers. So we'll click there. This is where a lot of the information that pertains to your work is housed. On the left side, you'll see several additional details such as training, certification, billing, rules, etc. So we encourage you to visit those when you have time to find the latest information on those topics. I want to take you to the rules and forms page because we often get questions about how to find the administrative code or other departments' administrative code. So if you come to the rules and forms page and then you select the currently effective rules, it will bring you to the page that has the launch of the Ohio Administrative Code website, this blue box on the right, but you can also select the link on the bottom. And know that the Ohio Administrative Code website, which we're going to launch right now, it will automatically take you to the Department of Aging's administrative code, but know that this is for all state departments. It has all of the administrative codes listed here, so you can do a search at the top to find, for example, the Department of Health rules. As many of you know, our service rule for assisted living has many instances where it points directly to the Department of Health residential care facility rules. So again, you can come to this location and find all of the rules that you need. So for our purposes, for assisted living, if I scroll down to 173-39 provider certification, and then point 16 is the assisted living service rule that we will be reviewing today. I encourage you to print this out so that you can take notes during the presentation, or at the very least bookmark the website so that you can reference it in the future. This will be what we will be going over in detail today. Now I want to talk about resident agreements. And the reason we're going to briefly touch on this is because it is going to impact the community transition service that many of the assisted living providers are also contracted to provide. We'll get into that in the next slide. But as a reminder, residential care facilities per the Department of Health Rule 3701-16-15 are required to provide the furnishings and supplies that you see listed here on paragraph C. Goes through 1 through 7. So for example, shower curtain, bedside table, bed linen, etc. Unless the resident care or resident agreement states otherwise. So the PAA provider relations staff, when they do their annual on-site reviews, but also when they do their memory care reviews, they may be looking at the resident agreement, not only to ensure whether the agreement complies with the home and community-based service settings rules. For example, they might be looking to confirm that there are agreements that address the evictions process. That is a requirement in the home and community-based setting service rules. But they're also going to be looking to see if the agreement specifies when providers are not going to provide the furnishings and supplies that you see here on the screen. And again, the reason this is important now is because of how it's going to impact community transition services, which we are going to talk about next. Community Transition Services, which is in Ohio Administrative Code 173-39-02.17, recently had an update to the rule. Know that this rule points to a Department of Medicaid rule, so you'll see the update reflected there. But moving forward, community transition services are not going to cover any of the furnishings and supplies that the provider is going to be providing. And the way that we will know which furnishings and supplies are being provided or not being provided is through the resident agreement. So for example, the resident agreement states that the provider will not be providing bed linens and a wastebasket. Therefore, the Community Transition Service will cover the cost of those items. You may be getting requests from transition coordinators or other staff asking for a copy of the resident agreement to verify what is and is not going to be provided to the individual. So please ensure that your resident agreements are updated to reflect this accordingly. As part of ODA's commitment to ensuring long-term care facilities and in-home service providers have the necessary resources to deliver a high quality of care and ensure high quality of life to all individuals, ODA and the Department of Medicaid have updated the rates for the assisted living waiver. So you no longer have the three-tiered option. Moving forward, there is just the base assisted living service and the memory care assisted living service. And you'll note the two billing codes for each of those services here on the screen. And the base assisted living rate is $130 a day, while the memory care assisted living rate is $155 per day. Back in December, the Department of Aging emailed all current assisted living waiver providers with a memory care attestation, asking that if they wanted to receive the higher rate and deliver the memory care service, that it be submitted back to the department by January 15th, 2024. Many of you have submitted the attestation and have received confirmation from me that it has been received. For providers who missed that deadline after January 15th, 2024, you will not be able to complete an attestation and will instead have to follow the regular process for adding a new service to your contract. If you have questions about adding a new service, please contact your provider relations staff or the Department of Aging. For those providers who did submit an attestation by January 15th, an on-site visit by the PAA provider relations staff will be conducted within the first 6 months of 2024 to verify compliance with the memory care service requirements. We received many questions about whether the memory care attestation meant that the memory care certification has been approved. And if you submitted an attestation, know that that was shared with the PAA case manager, who was then directed to authorize that service for every individual who had a documented diagnosis of any form of dementia. So essentially what this means is that person-centered service plans needed to be updated by the PAA case managers to reflect the service authorization within the service plan. If you have not received an updated person-centered service plan, please contact the case manager to verify whether the service authorization took place for the memory care service. And again, this will then allow you to not only deliver the service, but to bill for the memory care service as well. We're going to go over the updated assisted living service rule, which is Ohio Administrative Code, also known as OAC 173-39-02.16. Again, if you have this rule printed out, I recommend that you take notes as we move forward during the presentation. Some things that are higher level that I want to draw your attention to before we dive deeper into the rule is to note that the assisted living service rule includes the requirements for the memory care service as well. So they are combined into one rule. Certified memory care providers must comply with all of the base or basic assisted living requirements along with the memory care requirements. Also, private resident unit language that was in the old version of the rule is been changed to single occupancy resident unit. So you will see that language single occupancy resident unit within the updated service rule. Another important update to the assisted living service rule is the language around locks. So you'll see here the updated language says the resident unit has a lock that allows the individual to control access to the resident unit at all times unless the individual's person-centered services plan indicates otherwise. So this is updated language compared to the previous version, and we want to reiterate the importance of following this rule because it is not only in the Ohio Administrative Code, but it is also in the Code of Federal Regulations, which we commonly refer to as the HCBS settings final rule, HCBS settings requirements. So the lock must exist on every waiver resident room unless there is a person-centered service plan that indicates otherwise. So please ensure that if you have concerns about having a lock on a room, that you review it with the PAA case manager, that you talk to the individual, their families, their other natural supports as appropriate, and that the person-centered service plan reflects any modification from that requirement. Now we're going to talk about the specific memory care service provider requirements. So at the top of the rule, you'll see, as it relates to the memory care, you'll see paragraph D, and then 2A, it says that the provider displays a purpose statement on its website that explains the memory care service that the provider provides. So if you are a certified memory care provider, which means you submitted the attestation, we are requiring that you have a purpose statement on the website that on a very high level, it does not need to have a lot of details, but that it has a purpose statement about the memory care service that you are providing. When the provider relations staff do their on-site review, they will be verifying that that exists. So please make sure that the website reflects that update. The next memory care service requirement says that the provider designates the single occupancy resident unit that's defined in paragraph C2C of this rule to be a standalone memory care unit, a memory care unit in a memory care section of the RCF, which is the residential care facility, or a memory care unit in an RCF of a provider that provides only memory care. What this translates to is that the provider isn't restricted to providing this memory care service only in a specific area of the facility, which typically would include a secured or locked or specialized care unit. The memory care service can be delivered anywhere within the facility as the provider wishes, as long as the provider can demonstrate that they're meeting the rest of the memory care service provider requirements. We didn't want to eliminate the possibility of providers not being able to deliver this service outside of a specialized care unit or locked unit. So we wrote this rule to allow providers the flexibility to make the decision on how they feel it is best to meet the rule requirement as well as the individual's needs and the service delivery requirements. If you have questions about what this means, again, please call your provider relations staff or the Department of Aging to get more clarification. The next provider requirement for the memory care service is that the provider provides or arranges for at least 3 therapeutic, social, or recreational activities listed within Rule 3701-16-11 of the Administrative Code, which is an Ohio Department of Health rule, per day, with consideration given to individuals' preferences and designed to meet individuals' needs. So this requirement for providers to follow 3701-16-11 exists for the basic assisted living service as well, but the difference here for the memory care portion of the rule is that you have to provide at least 3 of these activities per day. So the provider relations staff will be verifying that there is an activity calendar or some sort of documentation to demonstrate that 3 of these activity types are provided per day for the individuals who are receiving the memory care service. The next requirement for the memory care service says that the provider ensures safe access to outdoor space for individuals. Compliance with this rule is going to look very different for each provider, partly because of the physical layout of the building, but also based on where the provider is delivering the service within the setting. So PAA provider relations staff are going to work with each provider to provide technical assistance about how the provider is going to meet this rule requirement. Particularly for providers who don't have access to outdoor space if they are delivering that service on a locked or secured unit. So please reach out for guidance on how you're going to meet this rule requirement or wait for an on-site visit. Some questions that we have received about implementing this have prompted us to generate some best practices. And one of the things that we can share now is that it would include ensuring that the person-centered service plan reflect the preferences of the individual in regards to outdoor space. So for example, if individuals have a preference on the time of day that they want to be outside or the length of time that they want to be outside, that information would help the provider come up with a plan for how they're going to ensure safe access to outdoor space for the individuals who are receiving that service. The next requirement states the provider assists each individual who makes a call through the resident call system in person in fewer than 10 minutes after the individual initiates the call. I want to point out that it says that the provider assists each individual within 10 minutes after the individual initiates the call. It's not stating that the call light is just answered. It is stating that the provider is assisting the need of the individual within 10 minutes. So in terms of compliance and measuring compliance with this rule, again, it's going to be based on how the provider is managing their resident call system. So if there is an electronic system, it will be easy to monitor the 10-minute requirement. It may look different if a provider does not have that electronic tracking system and will have to do a manual tracking. And we will also measure this based on feedback from residents as well as family members. So please ensure that you have practices in place to meet this rule requirement for 10 minutes or less. The next memory service provider requirement is related to staff availability. The provider has a sufficient number of RNs or LPNs under the direction of an RN on call or on site at all times for individuals receiving memory care. This is an additional requirement above and beyond what the base assisted living service requires. And so please ensure that you have either an RN or an LPN on call or on site at all times, and the definitions for what includes being on call or on site can be found within the Department of Health rules. I also want to note that the language of under the direction of an RN is going to be eliminated from this rule in the future, and instead it will say LPNs, and it will point back to the definition of LPNs, which is under the revised code for the Ohio Board of Nursing. The next staffing availability requirement is the provider maintains the appropriate direct care staff to resident ratio below. So depending on the service that the provider is providing will depend on which of the next 3 staffing ratios they are going to comply with. The first one that you see here on the screen, if providing both memory care and the basic service, a ratio that is at least 20% higher than the provider's ratio for its basic service. So this is applicable for providers who deliver both the basic service and the memory care service. And this does apply for most of the providers who did submit the attestation. And you will use the staffing ratio that you have for the basic service and add 20% to that. We plan on providing more technical assistance about what this will look like and best practices in the future. So please talk with your provider relations staff when they do an on-site visit about how this is going to be measured for compliance and how you will document that for compliance moving forward. The next 2 staffing ratio options are applicable for providers who are only delivering the memory care service. So you have one of 2 choices for determining the memory care service staffing ratios. And that is if providing only memory care and the average ratio for the basic service provided by a representative sample of providers participating in the Medicaid funded component of the assisted living program is readily available to the provider, then a ratio that is at least 20% higher than that average ratio. So what this is saying is that you are a provider who's only delivering memory care. You don't have a basic service that you're delivering, and that means you don't have a staffing ratio for that basic service. So this is saying that you have readily available data of other basic staffing ratios from other assisted living waiver providers in your area, and you have then added 20% for your memory care service to meet the staffing ratio requirements. Just for context, many of the attestations that were submitted to the Department of Aging did not include this staffing requirement. And the last option for staffing ratios is for, again, providers that are only delivering the memory care service. So again, you can either follow this staffing ratio requirement or the one on the previous slide if you're just delivering the memory care service. Otherwise, you have to follow the first staffing requirement that was for providers delivering delivering memory care and the base. So if providing only memory care and the average ratio for the basic service provided by a representative sample of providers participating in the Medicaid funded component of the assisted living program is not readily available to the provider, then a ratio of at least one staff member who provides personal care services for every 10 individuals receiving memory care, with at least one staff member who provides personal care services on each floor of the RCF, which is the residential care facility, if the RCF provides memory care on multiple floors. So different from the previous slide where that data of basic staffing ratios is not available to the provider, then you would use a 1 to 10 staffing ratio. But the difference here is that the provider would need to ensure that there is one staff member on each floor where the memory care service is delivered if it's on more than one floor. Initial staff qualifications are next, and please note that this rule does point to additional trainings that are required within the basic service. That's paragraph C5, so please reference that as well. But the following topics are required for initial staff qualifications: overview of dementia, foundations of effective communication in dementia care, common behavior challenges and recommended behavior management techniques, current best practices in dementia care, and missing resident prevention and response. The Department of Aging's website has some trainings about dementia, so please look to the Department of Aging training section for providers to get some resources, and know that we will be providing additional tools and resources in the coming year, so please revisit the website often to look for those. There is a chance that some providers are already training on these topics, so please make sure that the records include these topics so that provider relations staff can verify them. If you need help in finding trainings that cover these topics, please call the provider relations staff too, and they can help in researching topics, and they will be working closely with the Department of Aging to provide that resource as well. Next is the ongoing in-service training requirements that are needed. So it states a staff member continues to qualify to provide memory care only if the staff member successfully completes dementia care training when complying with paragraph C6 of this rule. So C6 essentially points back to the Department of Health regulations for training when providing dementia care. Please make sure that you have received updated person-centered service plans for each individual who has a documented diagnosis of any form of dementia who's going to be receiving the memory care service. You signing them and returning them to the PAA case manager is going to be your go-ahead to deliver the service as well as bill for the service. Make sure that your staff are updated on any changes to the person-centered services plan, particularly around the memory care service, which is going to include having the case manager reflect preferences for the individual, like the therapeutic, social, recreational activities, as well as preferences for access to outdoor space. Those are not all of the things that are included in the person-centered service plan, but these are just the ones specific to the memory care service. We want to ensure that you as providers are continuing to work and communicate with the individuals who are receiving the service, the staff who are delivering the service, their families, and other natural supports, so that the person-centered service plan reflects the most up-to-date goals, service needs, preferences, etc. Before we finish the presentation, let's review the next steps. Please prepare policies, records, documents, etc. to demonstrate compliance with the memory care service requirements. The PAA provider relations staff will be conducting on-site reviews within the first 6 months to verify compliance with the memory care service. So best practice would be to have all of your records associated with conducting the review in one location and to have them readily available so that the provider relations staff can start their reviews timely. Like I said earlier, you can find training resources on the dementia topics listed for initial staff qualifications on the Department of Aging's website. Please revisit the website often because we will be adding to that. Continue conversations with individuals, their families, case managers, because we really want to ensure that the person-centered service plan reflect not just the memory care updates, but all updates to someone's preferences and their goals, their strengths, their weaknesses, and any other things that need to be reflected there so that they are receiving the highest quality of care from your staff. And then lastly, if you have any questions about this training or any other questions related to delivering the service, please call your provider relations staff with those questions. This concludes the Ohio Department of Aging's training. Thank you for your time.